Hello everyone, welcome to the February 2025 in-service for the Northwest Kidney Center. Today we're going to talk about something called dialysis vintage. Most often the term vintage refers to something that's really old, like vintage furniture or vintage clothing, or commonly used to describe the production of wine. So the year of the wine's production is referred to as its vintage. In this case, dialysis vintage refers to the duration of time someone has been on dialysis. And unlike fine wine, dialysis patients do not physically improve with age or longer vintage. This talk has two purposes. One, I want you to understand why dialysis vintage matters. And two, recognize the problems that occur with increasing dialysis vintage. All right, to address the first objective, let's now discuss dialysis vintage. So what exactly is dialysis vintage? It is defined as the length of time someone has been on dialysis. And why does it matter? Well, because dialysis is very hard on the body over time, and problems accumulate the longer someone's been on dialysis. Specifically, there are a number of physiologic changes that occur the longer someone's on dialysis. These include the following. Left ventricular hypertrophy. This is a thickening of the heart muscle, typically in response to volume overload and or hypertension, and it's accompanied by scarring of the heart muscle. And this affects the smooth conduction of electricity through the heart, which in turn leads to arrhythmias and can lead to cardiac death. The longer someone's on dialysis, the more likely the blood vessels are to calcify. And this is a CAT scan, and you can see in the central portion of the CAT scan the outline of the aorta branching off into the iliac arteries. And the wall is completely calcified. You can see this, the white highlight of the wall, and that's calcium deposition in the blood vessels. So over time, high phosphorus levels in the blood stimulate the production of bone proteins inside vascular smooth muscle cells. So literally, the blood vessels turn to bone. We call this calcification of the blood vessels or so-called hardening of the arteries, and this significantly increases the risk of a vascular event, such as a heart attack or a stroke. It can also lead to calcification of arteries in the pelvis, where a kidney transplant would potentially be sewn into the body. So vascular calcification can sometimes disqualify a patient for transplant. Loss of muscle mass is a common physiologic occurrence the longer someone's been on dialysis. And this occurs for several reasons: because of decreased activity or immobility, because of chronic inflammation, nutritional deficiency, and the loss of muscle mass is associated with an increase in mortality. The longer someone's on dialysis, the more likely he or she will develop cognitive impairment. Basically, people on dialysis tend to develop impaired cognitive function compared to the general population, particularly the domains of orientation and attention and executive function. Patients who don't have dementia but live independently also present an accelerated brain aging phenotype. And this is true even after taking into account the effects of age and diabetes and depression and other problems that dialysis patients often have. So what are the complications associated with longer dialysis vintage? A big one is increased mortality. So the longer dialysis vintage, the longer someone's been on dialysis, the more likely that person is to die of all-cause mortality, cardiovascular death, or from infection. This is a study published by Sumida in Nephrology Analysis Transplantation in 2016. It was a retrospective cohort study of 216,000 patients receiving maintenance dialysis for at least 1 year by the end of 2009. And these people were divided into dialysis vintage categories. So people who were on dialysis between 1 and 2 years, 2 and 5 years, 5 and 10 years, 10 and 15 years, 15 to 20 years, 20 to 25, 25 to 30, and finally greater than 30 years. And the authors look for associations with 1 year all-cause and cause-specific mortality, including cardiovascular disease and infection-related mortality. And during 1 year study, there were 18,614 deaths from all causes, about 7,200 from cardiac and 3,500 from infection. Then they did multivariate analysis, basically where you're trying to control for, age and the presence of diabetes and high blood pressure and coronary disease and all the other factors that people might have. And what they found was a longer dialysis vintage was incrementally associated with a higher risk of all-cause mortality. So for every vintage group, from 1 to 2, 2 to 5, 5 to 10, 10 to 15, 15 to 20, etc., each successive group had a higher risk of all-cause mortality. Similarly, each successive group had an increased risk of infection-related mortality. So the longer you're on dialysis, the more likely you are to die from infection. And there was also a 64% higher risk of cardiovascular mortality with increasing vintage for people who've been on dialysis more than 30 years compared to just 1 to 2 years. So in summary, dialysis vintage is associated with all-cause mortality, infection mortality, and cardiovascular mortality. Longer dialysis vintage is also associated with the development of atrial fibrillation. So atrial fibrillation is the most common form of arrhythmia or abnormal heart rhythm in dialysis patients, and it's clinically significant because its presence is associated with the development of heart failure and mortality in dialysis patients. So those who have atrial fibrillation have twice the mortality rate of those who do not. As an aside, the presence of atrial fibrillation is not associated with the increased risk of stroke among dialysis patients, unlike in the general population. At least it's not consistently associated with that in the studies that have looked at that question. So it turns out the longer you are on dialysis, the more likely you will develop atrial fibrillation. This was a prospective observational study of 47 hemodialysis patients who were divided into 4 groups. The first group, within 6 months from starting hemodialysis therapy. Second group, same patient studied 18 months later. Third group, patients with no history of atrial fibrillation and long dialytic age. And then finally, patients with sinus rhythm but a history of atrial fibrillation. And they were compared, basically they did echocardiograms and EKG, and what they found was that longer dialysis duration was associated with slower conduction of electricity through the atria, so a longer so-called PR interval and a greater risk for atrial fibrillation. The study also found that the prevalence of atrial fibrillation among people who started dialysis was between 5 and 10%, but after you had been on dialysis for more than 4 years, about a third of patients had atrial fibrillation. The longer a patient is on dialysis, the more likely he or she will develop nutritional deficiency. And there are a whole bunch of reasons for this. A decrease in appetite, decrease in activity, increase in catabolism. Dialysis is very catabolic activity. Additionally, you also lose glucose and protein with diffusion during the dialysis procedure, so you actually lose calories with the dialysis procedure. And most dialysis patients are just sick in general and therefore have chronic inflammation, which increases their metabolic rate. So what are the nutritional changes that occur in a dialysis patient over time? This is a study published by Chertow that looked at vintage nutritional status and survival in dialysis patients. It was an observational cohort study of about 3,000 dialysis patients divided again into vintage dialysis groups. So basically how long you've been on dialysis. And then they measured body composition as estimated by body weight, total body water, and body cell mass using something called bioimpedance plethysmography, which basically applies an electrical current to the tissue, and just depending on how that electricity passes through the tissue, you can tell whether or not it's muscle or fat or fluid. And what they found was that dialysis, the average dialysis finish in the study was 3.8 plus or minus 3.7 years. And body composition parameters tended to decrease after the second year. So specifically body weight, total body water, and body cell mass decline after 2 years. And there's a 4% higher rate of death associated with each additional year on dialysis. So every year you're on dialysis, you have a 4% higher risk of dying. In conclusion, dialysis vintage is related to nutritional status with greater vintage associated with a significant decline in all measured nutritional parameters. Body composition also changes over time in peritoneal dialysis patients. This is an observational study of 65 peritoneal dialysis patients who underwent bioimpedance plethysmography to analyze body composition. And then they were followed them for up to 11 years over the course of the study. At enrollment, the mean, median, and maximum dialysis vintages were 51, 34, and 261 months respectively. And after adjusting for all these covariates, basically dialysis vintage was indirectly correlated with body weight, body mass index, body surface area, red cell mass, and total fat. So basically over time, the longer you're on dialysis, the lower your body weight, so the more likely you are to lose weight. You lose your body mass index falls, lower body cell surface area, decreased body cell mass, and decrease in total fat mass as well. Survival was significantly higher in patients who had shorter dialysis duration compared to those who had been on dialysis for more than 3 years. Longer dialysis vintage is also associated with greater prevalence of just unpleasant symptoms such as anxiety and fatigue that affect quality of life. So a Chinese study published in 2023, a cross-sectional study that included patients on hemodialysis, and all of these patients were assessed using something called a dialysis symptom index. Basically, find out if they had any unpleasant symptoms. This is a validated instrument of 30 questions to assess the severity of unpleasant emotions and symptoms in hemodialysis patients. There were 146 patients who were enrolled. 35 or 24% had a dialysis vintage of less than 12 months, and 76% had dialysis vintage of greater than 12 months. So they divided those into two groups, and they found that patients who went on dialysis for more than 12 months had significantly higher dialysis symptom index scores. And these included things like just feeling tired, lack of energy, trouble falling asleep, all the things that can affect your quality of life. So this study showed that the longer prevalence of the longer dialysis, the vintage, the more likely you are to accumulate symptoms that people consider to be unpleasant. Physical ability also declines the longer you're on dialysis, and this doesn't come as a surprise to anyone, but we demonstrated in a study by Ishiwatara in 2020 of 892 maintenance hemodialysis patients who were 60 years or older. And basically, they assessed their physical ability using kidney disease quality of life short form at baseline, and also incorporated data from the Japanese DOPS trial, or dialysis outcome and practice pattern study. What they found was that patients who were older and had been on dialysis longer had lower PCS scores, or lower physical component summary scores, than people who had been on dialysis for a shorter period of time. So that's something that most of us already know, that the longer you're on dialysis, the more physically frail you become. Dialysis vintage is also associated with a medical problem called dialysis amyloidosis. Dialysis amyloidosis is a serious, often debilitating condition that affects patients who've been on dialysis for a long time, typically more than 5 years, and is characterized by the deposition of an abnormal protein aggregate called amyloid in various tissues and organs of the body, and that can affect the function of those organs. So again, it's not something that we see in patients who have been on dialysis just 1 or 2 years. It typically occurs in someone who's been on dialysis for more than 5 years. So it's a condition that primarily is associated with the accumulation of a specific type of amyloid protein known as beta-2 microglobulin. It's a small protein. It's normally present in the blood, and normally the kidneys filter it out of the blood and excrete into the urine, but in patients with dialysis, the kidneys lose the ability to effectively filter it out, and it's not removed very well with dialysis, where you need a lot longer dialysis duration to effectively remove it, and so as a result, its concentration in the blood increases significantly over time. And then the excess beta-2 microglobulin can form these insoluble fibrils that accumulate in various tissues, particularly the bones, the joints, and soft tissues. And these abnormal protein aggregates, so-called amyloid deposits within certain organs, and that can cause structural damage and interfere with the normal organ function. And the clinical symptoms depend on the organs that are involved. So people oftentimes have joint pain and stiffness, or they get this numbness and tingling in the hands as a consequence of something called carpal tunnel syndrome. They can develop bone fractures, deformities. You can also get amyloid deposition in the heart and develop heart failure. Long-term dialysis is also bad for your mouth, specifically for your oral health. This is a cross-section of multi-center study in Germany whose purpose was to investigate the association of dialysis vintage time in maintenance hemodialysis patients and their oral health problems. So they looked at 190 dialysis patients and divided them into four groups depending on dialysis vintage. So 0 to 2 years, 3 to 5 years, 6 to 8 years, 9 to 12 years, 13 to 20 years, and more than 20 years. And then they assessed the oral health impact with a couple of oral health surveys and questionnaires. What they found was that most people needed dental work over time. So 92% of all the dialysis patients needed some sort of either dental or periodontal work. And the longer you were on dialysis, the more likely you were to have a low oral health score. And the pattern of psychological impact was significantly associated with dialysis duration and oral function. Just how well you chew was also negatively correlated with dialysis duration. So the longer you were on dialysis, the more likely you were to have oral dysfunction. Frailty increases over time in dialysis patients. So the longer you're on dialysis, the more frail you become. And even young patients develop frailty with greater dialysis vintage. This is a study published by Yamamoto in American Journal of Kidney Disease in 2024. A cross-sectional study of dialysis patients, 227,000 dialysis patients above the age of 50, who were divided into different dialysis vintage categories: 0 to 5 years, 5 to 10, 10 to 20, 20 to 30, and over 30 years. And amazingly, in this study, over 5,000 patients have been on dialysis for 30 years or more. And these, by far, were the most frail patients. So 36% were very frail, 6.4% were bedbound. What they found was that the frailty score increased for every dialysis vintage group, particularly beyond 30 years. Cognitive impairment is also common the longer you're on dialysis. And in part, we think this is because the dialysis procedure itself is associated with decrease of blood supply to the brain. So during every dialysis session, blood supply actually to the brain actually decreases and it returns to baseline after the treatment. But when that happens time and time again, 3 times a week for many, many years, you can see how that might, impact cerebral function. This was demonstrated in a study published by Drew et al. In American Journal of Kidney Disease in 2017. It's a longitudinal cohort study of 314 dialysis patients who underwent cognitive function assessment using neurocognitive tests at baseline and then every year that they were on dialysis. The mean age was 63, a little over half were men, 22% were black, and 90% had at least a high school education. They were followed for a median of 2.1 years. What they found over time was that in every increase in dialysis vintage group, so the longer you're on dialysis, there was a decrease in executive function and also a decrease in your yearly mini-mental state exam score. So the longer you're on dialysis, the more likely you are to develop significant cognitive decline and a decrease in executive function. Long-term dialysis is also very hard on your muscles and your skeletal system. This was looked at in a study by Hage et al. In Clinical Rheumatology in 2020. Purpose of the study was to estimate the prevalence of musculoskeletal problems in dialysis patients over time. It was a study done in France, and basically they looked at baseline demographic characteristics, musculoskeletal symptoms, biologic parameters, and their dialysis treatments. Among the 89 dialysis patients that participated, mean age was 67 years and the mean dialysis vintage was 5.7 years. And most patients reported significant musculoskeletal symptoms, in particular pain, arthritis, history of fracture, and dialysis vintage was significantly associated with all of these: osteoarthritis, carpal tunnel syndrome, and fracture. So the longer you're on dialysis, the more likely you are to develop these common musculoskeletal disorders. Longer dialysis vintage is also associated with decreased function of kidney transplants in those who eventually receive them. The long-term performance of kidney transplants was looked at in this 2022 study by Lim. There were over 4,000 first-time kidney transplant recipients who were enrolled in a prospective nationwide study in Korea. And these patients were divided into tertiles according to how long they had been on dialysis before. The first tertile, so the people who have been on dialysis the least amount of time, showed no increased risk of allograft failure compared to people who had received living donor kidney transplants. But the longer you've been on dialysis, so the second and third tertile groups had a significant increased risk of graft failure compared to people who had not been on dialysis for very long. And all of the deceased donor groups had a significantly higher risk of death than those people who had received a living donor transplant and not been on dialysis. So, in summary, the longer you're on dialysis, the less likely a transplant is going to be successful in the long run. So if longer dialysis vintage is so bad, how can we shorten it? Well, there's only one way for someone with end-stage renal disease to get off dialysis and continue living, and that's with a kidney transplant. So what can you do? Essentially encourage our patients to consider transplant and get their evaluation completed at one of our local transplant centers as soon as possible. The sooner they get activated on the list, the more likely they will receive a kidney transplant and shorten their dialysis vintage. All right, let's summarize what we've learned today. Dialysis complications accumulate over time. The longer someone's on dialysis, the more likely he or she will develop left ventricular hypertrophy, vascular calcifications, loss of muscle mass, decline in cognitive function, among other problems. Longer dialysis vintage is associated with a lot of problems. Increased all-cause mortality, death from cardiovascular disease, and infection-related mortality, an increased prevalence of atrial fibrillation, a decline in nutritional status and muscle mass, increase in prevalence of adverse symptoms such as fatigue and anxiety, an accumulation of a protein called beta-2 microglobulin amyloid in various tissues of the body, particularly in patients who have been on dialysis for more than 5 years, periodontal disease, higher risk of frailty and being bedridden, progressive cognitive impairment, increased prevalence of musculoskeletal problems, including osteoarthritis, carpal tunnel syndrome, and fractures, higher risk of composite death and graft failure in patients who received a kidney transplant. Hope you're paying attention because it's time for the quiz. Question number 1. What physiologically improves over time on dialysis? The answer is absolutely nothing. I mean, patients may mentally get more experience, more compassion, more perspective, all that kind of stuff, but physically, nothing gets better. Question number 2. This protein may accumulate in internal organs of dialysis patients, particularly after more than 5 years of dialysis. That's right, beta-2 microglobulin amyloid. Question number 3. Name 3 musculoskeletal problems that increase in prevalence with longer dialysis vintage. That's right. Osteoarthritis, carpal tunnel syndrome, fractures. Question number 4. Does dialysis vintage impact transplant kidney performance? Yes, and not for the better. So the longer you're on dialysis, the less likely a transplant will do well. True or false? Infection-related mortality increases with greater dialysis vintage. And the answer is true. This concludes the February 2025 in-service for the Northwest Kidney Center. In summary, the longer you're on dialysis, the more likely you'll develop problems, so it's very important to shorten the amount of dialysis duration, that is, keep the dialysis vintage low. Encourage our patients to get a kidney transplant. This is Andy Brokenborough signing out until next month. Thank you for your attention.